What are your thoughts on omega-7s specifically? When we talk about like the omega fatty acids, a lot of times we talk about omega-3 and 6. Omega-3 in general are going to be our anti-inflammatory fatty acids. Omega-6s are going to be from seed oils and things like that. Those are more of our inflammatory fatty acids, which not necessarily the entire story when it comes to omegas. So it's important that we kind of differentiate that a little bit. And then omega-7s are getting a little bit more recognition lately. They're important for, mucous membranes. They can improve insulin sensitivity, and they can really help to modulate that inflammatory response through CRP and then another substance called NF-kappa beta. So really when we're talking about omegas, if you get a high quality fish oil, you're going to look for that, and you're going to see omega-3s is kind of the main thing. The big thing is the ratio of omega-3s to omega-6s. And if that ratio gets too high, that means we're leaning more towards an inflammatory diet. So high omega-6 to a high omega-3 ratio, we want to keep that around 5-to-1, which means about 5 times more omega-6s than 3s. If we start getting up into the 10s, 20s, 40s, 100-to-1, that's going to be someone who's super predisposed to inflammatory events. You're going to have a much higher risk of cardiovascular disease. And so a lot of times we talk about, what type of steps can I do to fix that omega-3 or omega-6 omega-3 ratio. And a lot of times we talk about adding in fish oils and things like that are high in omega-3s. But for most people, especially if your omega-6 to omega-3 ratio is super, super high, you're really not going to get all the way there just by adding in omega-3s.